World Mental Health Day is here. This day is observed to raise awareness about the significance of mental wellness. The theme for this year is making mental health and well-being for all a global priority. Hello everyone, I'm Richa, an intern under Dr. Sheba's top mental health studio called TalkSpace. Today we are in conversation with the founder and the chief psychologist herself, Dr. Sheba Singh. Dr. Singh is a PhD and has been practicing and professing psychology for over 20 years now. She is a parenting expert, an avid researcher, and has received awards from many esteemed organizations. Her areas of expertise are in treatment for anxiety, depression, OCD, and other psychiatric disorders, along with parenting, behavioral issues for children, couples therapy, and premarital counseling. Let's get talking with the psychologist herself, shall we? Good morning, ma'am. Thank you for taking out time to interview with us today. We are glad to have you here.
Thank you so much, Richa. And I'll be happy to talk about mental health as it is the World's Mental Health Day today.
Right, so wishing you a very happy Mental Health Day to you and everyone out there.
Yeah, we at TalkSpace are also observing World Mental Health Month rather than one day.
Right. You'll get to know more about this as we go ahead. So, since you run a mental health studio, you would be the right person to answer my first question. My question is that even after so much of mental health awareness, people are confused whether to go to a psychologist or a psychiatrist. So, could you help us understand the difference?
That's right, Richa. You're very right. So when people come to me also and they ask for medicine,
Right.
you know, and they say that I just wanted to see a mental health professional, and so I'm here for medicine. Right? And so many people go to psychiatrists, and some psychiatrists, my friends, they share with me that they come for just talking or some therapy, some talk therapy, and then they tell them that no, we are not the right people for talk therapy or cognitive behavioral therapy. So yes, there is a difference between psychologist and a psychiatrist. You know, so psychologist is trained in psychotherapy, and their line of treatment is psychotherapy, that is talk therapy mostly. We use a lot many other therapies also, but an approach, a psychotherapeutical approach is important for us. That's the main therapy. But the psychiatrists are trained in medicine and they treat mental illness with the help of medicine. So that's the main difference. So their qualifications are also different. So psychiatrists are MBBS and an MD in psychiatry, and psychologists are masters in psychology, MPhil in psychology, or the highest degree, that's PhD in psychology.
Right.
So it has to be at least a master's in psychology.
Definitely, I think this was very informing. Now that we know the difference, could you help us understand when can one visit a psychologist?
Anytime. Anytime. Whenever your occupational life, your social life is dysfunctional, whenever you face any adjustment difficulties, whenever you think that something is going not right, you will go and check with a psychologist. Whether everything is fine, whether you are able to deal with it, whether you need therapy, whether you need medicine. So go to a psychologist. That would be the best thing to do.
And we've heard so many times that going to a psychologist is like finding the right match. So how do we know if the psychologist is right for me?
See, first of all, you have to look for the qualification.
Right.
As I said, at least a master's in psychology is very important. Right? And also see the experience. You may also look at a psychologist's reviews on Google. You find so many psychologists these days on Google.
Right.
So you may look at their reviews, experience and qualification.
Okay.
Also, when you visit a psychologist, definitely you have to see whether there is good rapport with the psychologist or not.
Right.
Whether you are able to talk to the psychologist or not. You're comfortable with him or her.
Right. So there's so much taboo around what happens in the room of a psychologist. So, what is therapy? Is it just advising and talking?
It is definitely talking, but it's a structured talk. So a psychologist is trained in psychotherapy, which is very structured and scientific.
Right.
The patient may not get to know that we have a structure of questions.
Right.
It is not a perfect structure also, it's semi-structured. So whatever the patient says, we have another question out of that. And that is kind of a structured interview with the patient.
Right.
But we focus on how we ask questions or how do we talk to the patient. That's a very important thing,
Right.
which a layman would not understand. But yes, it is definitely not advising. It's definitely not suggesting anything. Because you and me are different people. What is right for me may not be right for the other person. So that's why it's not suggesting or advising at all.
Absolutely.
Yeah, it's very, very scientific.
Okay. So, talking about TalkSpace, so you are the founder here. So, could you tell us what we do at TalkSpace?
We actually do a lot many things. One is taking care of people, our patients, our clients who come here for therapy. That is one. Another is we train budding psychologists who are doing their masters in psychology. So we train them to be psychologists.
So
Yeah. So, and we do a lot of research also regarding different aspects, and we are very much present in media for our research and for what we do.
Right.
And like I have always taught in college and universities, so I have a research bent. So I don't leave my passion. So by say teaching or training my interns, and then definitely my passion is to treat people and help people also. So I do the same. Plus we also cater to schools and corporates where we spread awareness regarding different topics of mental health.
Okay, this is great. Coming back to therapy, there are so many people who come in and ask that, will anybody know if we are coming to therapy? So what do you have to say about that?
Yeah, definitely. Many people are scared that this is the room, it should not go out, no information should go out of this room.
Right.
So nobody would get to know. Yes, definitely therapy is very confidential, 100% confidential, and nobody would get to know. Our data is very secure and under lock and key.
Right.
Nobody is able to see that.
Absolutely. I think it's one of the major concerns for a lot of people. People also would like to know that what might their progress be with mental health look like in therapy. So what that progress looks like in therapy.
See, they become more functional.
Okay.
They are more able to deal with themselves, deal with their own problems. So they are well equipped with their own self.
Right.
We equip them with many techniques.
Yeah.
So whenever they have a difficulty, they may use a particular technique and get out of it or resolve it.
Absolutely.
So we make them self-sufficient.
Absolutely. I think many people think that coming to psychologists, they would get dependent on them. So
Definitely.
our job is absolutely opposite of it. Right?
Yeah.
Are there any topics that they should avoid while conversing with a psychologist in therapy?
I don't think so. So you go to a doctor, if you don't tell him what is your difficulty, how would he treat? Same goes here.
Right. And what is the general time frame where you can see some progress in your mental health in therapy?
Okay, that's a very good question, Richa. So when people ask me this, that as we enter psychotherapy, how much time will it take?
Right.
How many years will it take? Will it ever end?
Right.
So yes, it ends definitely. It's just like any other treatment. So you do a course of antibiotics, a 5 days course, and you are okay.
Right.
Here, because you're working on yourself, you'll have to take some more time for yourself. You'll have to spend some more time on yourself. And these are weekly sessions. So once a week.
Right.
And around 8 to 12 weeks.
Absolutely.
So you will start seeing results in 6 weeks. But then to get better and well, it takes around 12 weeks.
Right.
Depending on intensity and the difficulty.
Right. And like ma'am, you always say consistency is the key.
Definitely.
So definitely following that would help. Ma'am, also we'd all of us like to know what do we do in a mental health emergency?
Yeah. Yes. Again, I would quote some people. Say some people call me in the middle of the night when they are facing some difficulty or they have a panic attack. I'm okay with it. Say we can help them. Definitely we can help them. But I would suggest you need medicine at that time.
Okay.
So in any case of emergency, you need to reach out to a psychiatrist rather than your psychologist.
Okay.
Because you are in need of medicine. Because medicine will be a quick fix for your difficulty at that moment.
Right. Okay. Any other super quick technique that can help us in kind of emergency?
Reaching out, see if it is a panic attack, then definitely, and mostly it is a panic attack.
Right.
And you know, if you have a history of panic attack, you know that this is a panic attack and not any other physical difficulty. Then definitely, say washing your face with cold water or keeping ice in your hands or having an ice pack would definitely help at that time. So I would not suggest deep breathing at that time because that's not possible mostly.
Right.
But this is like a quick thing which you can do.
Ma'am, my last concluding question will be that many people still are in the kind of mind frame of how therapy would be a taboo around knowing if the society comes to know. So is taking help or coming for therapy a sign of weakness?
Not at all. I think coming for therapy, once you enter your psychologist's cabin, that's a sign of strength, I would say. Because you have come up to tell about yourself. Your difficulty is such a difficult thing. And you are there to discuss that with a stranger. That's a wonderful thing.
Right.
And I think as a psychologist, I feel the need to go for therapy sometimes. Because I cater to so many people and so many things affect me also. And same goes with any psychologist. When they cater to so many people, something or the other may reach them also. They are human beings. So they may also go for therapy. And I do so.
So I think two very emerging points from this was that therapists also need therapists, and also the fact that like our motto says that just coming to therapy is halfway done because it needs a lot of courage. So I think it's definitely, like you said, not a sign of weakness. Do you have any recommendations for people out there, budding psychologists or people in the profession?
For budding psychologists, I would say read a lot. Once you complete your qualification, please work under a psychologist to get trained first for at least 1.5 years and then start working on your own. And for general people, definitely I would say that please go for therapy. Whatever small thing you are facing, whatever it is, please go for therapy, resolve it and live your life.
Absolutely. Alright, thank you so much, ma'am. This was some great information, breaking all the taboos around here. And once again, everyone, wishing you a very happy mental health day. Thank you.
Thank you.